And we're joined now by NBC News medical contributor Dr. Natlalie Azar. Dr. Azar, good morning to you.
Good morning.
So listen, we know ovarian cancer can be tricky to detect and very challenging. So with that said, let's talk about some of the signs and symptoms of ovarian cancer that we need to keep an eye out for.
That's right, Chanel. One of the things that makes ovarian cancer diagnosis so challenging is that many of the common signs and symptoms are very nonspecific. They can be seen in a variety of other conditions. So we can put up this graphic here so women are aware: bloating, feeling full quickly, difficulty eating, pelvic pain or pressure. Additionally, women can experience abdominal or back pain, an increased frequency or urgency of urination, constipation, as well as abnormal vaginal bleeding or discharge. You know, there's not an automatic length of time that these symptoms need to exist before they become worrisome, but I would always caution women: know your body, and if the symptoms are not going away and they are not explained by an alternative diagnosis, please seek evaluation.
Dr. Natlalie, what about genetic testing?
Right. So we know that inheriting an abnormal variant in either the BRCA1 or the BRCA2 gene increases a woman's risk for a variety of cancers, in particular ovarian cancer. You know, over one's lifetime, generally in the population, about 1% of women will develop ovarian cancer, but an abnormal mutation in BRCA1, for example, increases that risk to about 39 to 44% of women. What was really important about Chris's story, and a message that I think is really important for women to understand, is that it appears her sister had what was known as a variant of uncertain significance, meaning that at the time that a variant was picked up in a BRCA gene, it was not at the time associated with cancer, and it was not common in the general population. But according to experts, about 90% of those variants of uncertain significance get downgraded to probably benign, but about 5 to 10% actually get upgraded to likely pathogenic or pathogenic. And this is what appears to have happened here. And so fortunately, Jeannie's family, in this case Chris, was made aware of the change in classification of this BRCA mutation that Jeannie had.
Dr. Azar, you touched upon this, but can you tell us any more risk factors?
Sure, yes. So some of the more common risk factors for ovarian cancer include age, a family history, a personal history of either breast, uterine, or colon cancer, never having given birth, past exposure to hormone replacement therapy, and women of Eastern European or Ashkenazi Jewish descent are at increased risk. And these individuals, for example, would be candidates for testing, genetic counseling at a minimum, to see whether or not they are candidates for testing for these genetic mutations that can increase risk.
Important information this morning. You said something that resonated with me. Listen, we all know our bodies, and so if something isn't right, you have to be your own advocate and just keep checking it out.
Go get tested. That's right.
Absolutely. Dr. Azar, thank you so much for your time this morning.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.